So headaches, one of the most prevalent conditions that that you'll see in primary care. Most people will come in with, some sort of headache. They're like, "Well, what's going on?" The differentials right off the bat, you should be thinking. So red flag signs, first thing that you should be asking. Okay, so anything starts with a history, onset, duration, frequency, and pattern. Okay, so those are the things that you need to at least suss out in the question. Depending on that, you can talk about, whether it could be a migraine, whether it could be a tension headache, cluster headaches, meningitis, temporal arteritis, or even TMJ dysfunction. There's also associated symptoms which you need to use in order to be able to differentiate between all of these headaches. Okay, so there's a lot of causes to headaches. You can have dehydration, altitude sickness, trauma. You can have migraines, giant cell arteritis also. There could be, temporal arteritis, trigeminal neuralgia as well that can cause headaches. Sinusitis can sometimes cause that, even glaucoma as well. So the differentials are endless. Okay, but the way you're going to be able to differentiate it is because of the history that they give you. Okay, and obviously red flag signs. So we'll go through those as well. Okay, so if there is any new severe or unexpected headaches, so people will, in the question stem, if it says that this patient differentiates, they might have a history of migraines, they might have a history of headaches, but if this is different, severe, almost like a thunderclap, okay, this is a classical thing, we're thinking about subarachnoid hemorrhage, okay, SAH. Right off the bat, you don't manage that. If you even suspect it, that needs to be referred immediately to A&E. Okay, that needs to be seen, and unless proven otherwise by a CT scan, you have to take the worst case scenario as the diagnosis. Okay, next thing is if you have a new onset headache in a patient aged over 50 years, again, think temporal arteritis or even an SOL or space occupying lesion. Again, there could also be an increasing headache, slowly increasing headache, nausea, vomiting. You can even have neck pain, stiffness, if there's any rashes, anything of that sort. If they've had a temperature, you're thinking meningitis, okay? But if there is an evolving headache, which is getting worse, particularly with any neurological signs or even papilledema, which can be a sign of increased intracranial pressure, if they've mentioned any of that, that needs to be assessed further, okay? Because we're in primary care, we need to be able to rule out pathologies. Once that's all ruled out, then we can go in and manage the condition, okay?